Hello, all. So, thank you for being here today. Namaste. My name is Dr. Jaya Daptardar. I'm Ayurvedic doctor practicing in Connecticut from last 22 years. I'm also healthcare executive and healthcare consultant and author of 3 books so far: Aging Gracefully, Ayurveda's Wisdom in Management for Pain and Addiction, Be Beautiful Inside Out. That's my new book just published in pandemic times. And today's topic is healing power of Ayurveda for addiction and recovery. So thank you again for being here with me. And let me share a slide with you. Just bear with me for a second. And share screen. Sorry about that. And it's here. Okay. So a healing power of Ayurveda for addiction and recovery. And here is my disclaimer for today. What is Ayurveda? It's 5,000 years old science, which talks about 3 pillars and its harmonious balance with mind and spirit. So you all learned what is Ayurveda so far, so I'm not going to explain. Ayurvedic wisdom. So this is the reason for my topic, healing power of Ayurveda for addiction and recovery, because Ayurveda has a strong wisdom which talks about tune up your body with the nature according to season and balance the elements in the body. So with that, there is a lot of scope from Ayurvedic perspective in terms of healing addiction and mental health. What is addiction? It is a compulsive need for and use of habit-forming substance such as heroin, nicotine, alcohol, or any type of substance characterized by tolerance and by well-defined physiological symptoms upon withdrawal. So we're going to talk more about this addiction in next slides, but it is a disease. It affects the brain functions, motivation, memory, and related activities. What happens is sometimes when you're stressed or you're anxious, or when you are going through some traumatic condition, then you take help of something which heals your mind. And that's where addiction comes in, because when you feel that this kind of substance or alcohol or smoke heals your mind, then you start doing it again and again. And then it forms a habit. And then that affects your brain, because brain memorizes that the amount of alcohol or substance you take, or um, a type of alcohol that you take, and your brain demands it over and over again. So and that is the reason addiction affects brain reward structures. Ayurveda calls addiction an intoxication, because these are the substances your body really doesn't need it. So these are the toxins going in your body over and over again, but you don't need it. So what are the causes of addiction? So addiction is, like I said, addiction is a chronic disease that affects brain, and it is not just limited to alcohol or smoke or drugs, but it can be gambling, it can be food, it can be um, sex, it can be computers, it can be phone, it can be exercise, it can be work. Some people are workaholic. So and some addictions might be worst or might get worst. So let's talk about the causes of addiction. So there are few causes that you can avoid, but not all. So genetic factors. Genetic factors doesn't mean that someone is born addict, or someone is addicted born. It's not like that. What does that mean is the biological differences that make someone more or less vulnerable to these habit forming addictions. It may be difficult for some people to tolerate certain kind of emotional experience, and some people have certain types of genes that they can quit easily once they start, but some people have genes that they cannot easily stop or quit. So that, according to Ayurveda, that is according to your body type or personalities, and that's genetic factor. So just for example, if one factor linked to anger or frustration is variable in another gene. So one type of personality, and according to Ayurveda, Pitta is the personality who cannot cope up with anger very easily. And that type of gene determines the makeup of brain receptors for the neurotransmitter dopamine factor. Another factor appears to be the natural response of body's hormones to stress levels. And some people, they cannot cope up with stress, and the relationship of the stress in our body's functionalities and immunity is very very much known, that it suppresses the immunity. According to Ayurveda, your mental health or mental hygiene matters. Some people are more emotional than others, and they can balance this and these energy forces, whatever the personality they have, Vata, Pitta, or Kapha, easily. And some people, they cannot. So that is all about genetic factors, environmental factors. So environmental factors are like you are working in the environment where people are addicted, or you're working in the chemical factory where they're making these drugs, or you're uh, vulnerable to have access to these kind of addictive substances or behaviors. Sometimes environmental factors are even close family members that they are addicted, or they are addicted to some other factors like gambling or food addiction. Culture. So culture is the one that affects addiction. In some cultures, it is okay, or it is just a tradition to have a glass of wine at night on the dinner table, or in some cultures, it is a kind of event like Holi that you have to, or people have to drink this bhang or that type of drug. So this is the culture. In some cultures, it is a norm for the family members to sit down and drink. Then cognitive and affective distortion, which impair perceptions and compromise the ability to deal with feelings, resulting in significant self-deception. So actually, this is about the self-confidence. So when you don't have a certain type of confidence in you, then you get more addicted to the substance or whatever the addiction medium is. And easy to access these addictive substances, that makes easier for the person to get addicted as well. So repeated engagement in the use of drug, prescription pain medication, or engagement in addictive behavior. So when I said when the availability, here in the United States, pain is very serious issue. And when you go to emergency room or doctor's office for pain, they measure your pain from 1 to 10. And if you cannot tolerate the pain level even 1, then you get the prescription. So when you have access to such kind of painkillers over and over again, there is a chance to get engaged in these addictive behaviors. Approach to pain relief. So according to Ayurveda, pain is a self-awareness. So that is Ayurvedic approach to pain. So when you are very weak in your confidence level or your self-awareness level, then you demand more painkillers or more techniques to heal your pains. So these are the causes of addiction and why people get addicted to. Approach to pain relief. So in America is all about 5% of the world's population, but we consume some 80% of the prescription drugs called opioids, the strongest and most addictive pain pills. Opioid overdose death rate is 1 every 30 minutes. It exceeds the death from motor vehicle accidents as well as the combined total death by heroin or cocaine overdoses. So Ayurvedic approach to pain relief, and this is very important. Ayurveda suggests a different approach to pain relief. Like I said, Ayurveda's approach is self-efficacy. It begins by viewing pain as a mind-body experience. So, simple example, when you're so busy and you get the paper cut, and because you're busy, your emotional response to it is very minimum. But when you are not busy at that time, you experience that pain very easily and intensely. So that is the mind-body experience, and that's highly subjective. Pain is approached through a phenomenon called self-efficacy, like I explained before. The brain contains many pain-relieving chemicals, and these can be triggered mentally, which is why taking placebo leads to pain relief in a significant proportion of people. Ayurveda's view towards addiction and dependency caused by the imbalance in mind level over the activities of mind. We try to calm down these imbalances of mind by activities, by um, artificial and excessive use of alcohol, drugs, food, or smoking. So Ayurveda outlines the therapy for overreacting mind through holistic nature. And this unique healing system creates a personalized approach to wellness. These therapies are individualized by nature of the elements in the body. So, in Ayurvedic perspectives, this addiction also has Vata imbalance, Pitta imbalance, and Kapha imbalances. So, Ayurvedic way to treat these balances is to balance the excessive element with herbs, with self-realization through mindfulness practices, yoga, meditation, breathing exercises, and social interaction with the family and counselor. So let's see the chart here. This is the statistics from National Center for Health Statistics. An average of 6 people die of alcohol poisoning each day in the United States. So in this chart, this age group is more vulnerable for between 45 to 54. This is a middle-aged group, and men are more vulnerable than women. 24% women, 76% men. And most people who die of alcohol poisoning are non-Hispanic whites, 68%, Hispanic 15%, and non-Hispanic Black 9%, American Indians 7%, Asian 2%. But I don't know, because I'm in this field from 11 years, and I have seen Asians have tendency not to go to the doctor or to the therapist for addiction, or they just deny. So that can be more than 2%. So this one is Americans consume more opioids than any other country, and this is more serious. This calculation is standard daily opioid dose for every 1 million people. So there are almost 50,000 people in 1 million people consume more opioids than any other country. And this is serious. National overdose deaths. Again, this is the United States ratio. This is the CDC statistics. And total overdose by the end of the year 2017, 72,306. That can be more now. And data is not available yet, but female ratio is less than male. Okay, so in drug overdoses, it's more than any other accidents or gun violences or falling deaths. So, and that is the reason why do we need wellness approach to help people with addiction. So what's happening in United States or the modern therapy, it is a revolving door because there is no holistic or spiritual approach to healing. People go to the therapies recovery centers and then they come out. When they come out, and if they don't have social support or other healing approaches or spiritual support to increase their mental capacity or tolerance level or the self-efficacy, we can say, then there is a revolving door because then they go back and relapse and then come back and then go back again. So that is the reason it's very important to have another wellness approach, which Ayurveda has a good approach, Ayurvedic approach for addiction. So the first thing is importance of mind body balance, mind body and spirit balance. To make a strong system, Ayurveda's wisdom is very important, that to recognize your imbalances, first your constitution and then imbalances, and balance them with your mind and spirit. Long-term balance to reduce the tendency of relapse. It is very important, like I said, otherwise there is a revolving door. So importance of the balance, if that balance is not recognized or kept, then long-term recovery is not possible, because our brain receptors, they sense and demand the same type of addiction where your mind is imbalanced condition. You cannot tolerate or take any more stress or emotions. Then it comes back again, the tendency to relapse. According to Ayurveda, addiction is intoxication. So symptoms that arise due to continuous use of high doses of substances that are intoxicating. So that toxic substance, ama, accumulates over and over again in the body. So Ayurveda calls good health is a good ojas in the body. That is a source of energy. But addiction, it is opposite, which is a opposite energy to ojas. It accumulates the toxins, which is a um, which is a killer instead of getting better. So alcohol, painkillers, or drugs, it diminishes the ojas in the body, it creates a bad energy than the good source of energy. So characteristics of addiction. First is inability to sustain. So, inability to abstain. So, what does that mean? That means because of the emotional stress, the person cannot control themselves. So their action to awareness of their body goes down, and they will become slaves of their minds. So they lose control over the awareness. So that is inability to abstain from the substances or addictive substances. So another thing is dysfunctional emotional response. So in that case, they are not aware, their efficacy level goes down, and they have dysfunctional emotional response. That means they demand more of that substance or drug or whatever type of addiction they have. Diminished recognition of significant problems with an individual behavior. So they diminish the recognition of the problem. These people are mostly in denial. They don't recognize that they have such a problem. And it is different individual to individual, but and that is that's where the impairment in behavior control, because that's where they impair their control over the mind. When that happens, the craving increases because your brain has that memory. The brain senses the type of alcohol that you're taking or amount of alcohol or drugs you're taking. And when you avoid it or when you don't take it, then you experience all these withdrawal symptoms. And to avoid those symptoms, then brain demands more of the same type of substance and same amount. That's where the craving and hunger for these drugs increase. Three energies or humors, doshas in addiction. So doshas are important in Ayurveda for addiction as well. The higher intake of drugs can lead to the aggravation of that type of dosha. So if vata is aggravated in some people and they take more drugs, so if they have certain type of hyperactivities, so with the addictions, whether it's smoke, whether it's drug, it increases, it aggravates again. Same thing with pitta type, anger, it creates more anger. Kapha type, it creates more laziness. So we'll find out the addictions by personalities or by the elements or the doshas, elevated doshas. So vata is the energy of movement, we all know. Pitta is energy of metabolism or digestion, and kapha is the energy of structure or lubrication. So what happens when there is aggravated vata in that type of addiction? It creates headache, difficulty breathing, hallucination, anxiety, erratic moods because of the nature of vata. So in this type, the individuals with vata type of addiction needs a good nourishment, because food is medicine in Ayurveda. A good nourishment of vata pacified food, warm soups or soothing food, relaxing food can diminish vata in the body. And herbs, they can diminish vata. So to calm down the mind and remove excessive vata, to balance it out. So in pitta type of symptoms, of course, it's pitta, so heartburns, digestive problems, thirst, diarrhea, fever, giddiness, and violence. So in this type of addiction, and again, just to clarify here that when we heal these patients through our Ayurvedic way, we still need to go with the medical protocol, because it all depends upon the intensity and the chronicness that they're addicted, and then all these addictions have co-occurring disorders. So they're not just addicted for the alcohol or the drugs, but also at the same time they have behavioral health problems. So behavioral health and addiction has a close relationship, because addiction happens when these behavioral changes happen in the mind. And then there is a correlation between their primary health. So it affects the primary health. and according to Ayurveda, it's very obvious when vata increases in your body and creates the vata type of illnesses, and then when that goes to the mind level, it creates the imbalance of vata in mind levels. So when modern medicine, according to modern medicine, when they treat these people, they treat them separately. They treat their mind separately. They have to go to psychiatrist and they treat them separately. Their addiction gets treated separately and their primary health issues get separate. So there is no correlation. But when we treat them Ayurvedic way, actually we bring their mind, body, and spirit together, find out what's going on, and try to balance it via Ayurvedic ways, Ayurvedic wisdom. So again, in Pitta type, we have to make sure that we offer them the herbs, they're pitta pacifying. We offer them food or nourishment that is pitta pacifying, or any yoga advice, the breathing exercises, they're all for the pitta, pacification of pitta. Then kapha type. So again, kapha type, they're earthy and they have more tendency to sleep, excessive sleep, lethargic, have heaviness in the body, nausea, and vomiting. So when we heal them Ayurvedic way, we always make sure that they're following the lifestyle of kapha pacifying, and we give them herbs to pacify kapha in their body. So Next is 4 stages of addiction. So in addiction, there are 4 stages. One is acute intoxication, and this is a very dangerous stage. I have seen um, patients, and more like a young population and students go through it, or tendency to try new things. And that's where this acute intoxication comes from, when you're not used to take certain drugs or smoke, or and then you just try it at once. So there are two things happen. One is it becomes toxin or intolerable, and then the overdose death happens, or you just become tolerant to it, and that is the first stage of addiction. So it becomes actually adaptive stage of addiction, early stage of testing drink or smoke. Then the second stage is withdrawal symptoms. So whenever these addictive substances, which are not necessary for your body, and you take it, but when the effect suppresses the effect, the symptoms due to the stoppage of alcohol intake, or after certain type of intake, certain time of intake, your brain or body demands more, and that's where the withdrawal symptoms you experience. And the person suffers from headache or nausea or vomiting, and show even tremors, the physical and psychological changes in the body. And at that time, these patients, they seek for more addictive substances, because then their brain demands more, and they become dependent on drug and alcohol, because they cannot tolerate the withdrawal symptoms. To suppress the withdrawal symptoms, they need more the drug, or whatever the addictive substance they're taking. And then the fourth stage is abusive step. So in this step, they start abusing it, because then their brain gets crazier with the cravings that they have, and then they go for anything. So they can be violent to get that, or um, they can steal it, or they can force it, or they can fight for it. And that's where when we give these therapies, and then I developed this Ayurvedic intensive 12-step program that we can go through it. I will not have more time to go in details, but this program is very helpful when people have their own doctor, psychiatrist, and the regular treatment is going on. After that, we can start Ayurvedic way. But when we start Ayurvedic way, does not mean that they have to stop taking everything and start doing this. No, there is a taper process that has to happen with their practitioner. With the same drug, they have to you can mix it with certain types of herbs in a small quantity, and then the lesser quantity and the lesser quantity, and then there is a stage where you can stop it. But it's a continuous process of engagement, the patient engagement, family engagement, and they have to be cooperative. They have to have that type of commitment. So these are the 12 steps. So first is the counseling, that they have to be prepared, and their family has to be prepared to go through this Ayurvedic way. And have faith on this system and have that spiritual level. If they don't have commitment, then you can't do it, and it is continuous process of engagement. Like I said, the practitioners like us, we have to be continuously in touch with them, maybe daily basis, maybe weekly basis, to find out what's going on with them. And this becomes support system for them, plus this becomes successful treatment from your side. Then there is a complete evaluation of mind body constitution, um, to find the root cause of dosha, genetic cause, environmental cause, and also what did they do before, what type of treatment they're taking, and to coordinate with Ayurveda. Then the third one is the herbal management for withdrawal symptoms. Then Ayurvedic cleansing, detoxification. You have to be very careful when you get to that stage, because the patient's body has to be ready to go through, because these people are very, very sensitive. They are immunocompromised, uh, and they go through so many social pressure, um, peer pressure. So you have to make sure that they are there in that level when you go through Ayurvedic cleansing. If they are not, then you have to start with a simple cleansing procedure, then the total Panchakarma procedure. When they're ready, then you can go to 1 day, 2 days, 3 days, and it all depends upon the chronicness and what type of drug they take, or alcohol. Drug is very, very difficult, because that has to be coordinated, plus they have to be clean for a while to go through this. Then they can keep up with their sobriety, and they can um, recover and not relapse. So lifestyle management for improving metabolism and strengthening immune system. Our lifestyle management Ayurvedic way is very helpful in their cases, because they have a lot of ama accumulation in their body, and they need cleansing, they need a proper nourishment, proper guidance to strengthen their system, uh, herbal remedies according to their imbalances, the stress management, anger management, balancing mind is a big thing. um, from mind level, relaxation techniques are recommended, breathing exercises for sinus pressure relief, because these people have a big problem of the sinus pressure, sinus infections, snoring, they cannot sleep, sleep apnea. So all these factors you have to consider while going through the 12-step program with them. Then you can recommend yoga steps in recovery, guided meditation. Karataka is one of the things I found out very, very helpful technique for their concentration, because they're lost. They're constant to bring back the concentration is kind of a technique that we have to use. And once they are used to these, some people are really recovered in this. We cannot keep up with this data. I tried many times, because of these so many factors involved, so many types involved, so many different treatments they have taken before, so many they're taking with Ayurveda, and also their their body reactions are different, their interactions are different. So it's difficult to to come up with the research on this, but I'm sure one day we will. Right now, our goal is to help somehow to them not to become a revolving door and not to relapse or overdose. So rejuvenation and finding life's purpose is very, very important because the um their origins is lost in this whole thing, and to regain the self efficacy, damaged tissues rejuvenation is very important, and to bring back their happiness is a big thing in these people. So I call this Ayurveda first aid, which is the primary home remedies may be used in withdrawal symptoms. And like I said, it is very important to find out in what stage they are, and you can get into when they are very chronic, in a very chronic stage, or when they are just in withdrawal with their high dosage. So that time this first aid doesn't work, but in small cases, in mild cases, it definitely works. Just to remove the impurities, the lemon juice mixed with water, in warm water, drink multiple times in a day. It helps as a cleanser. Ginger powder helps because in the juice, because it is also a type of pain relief for them. Then you can use cardamom and honey in pitta type of addiction. Then grape juice is very helpful. I found out that raisins soaked in water, a handful of raisins every 2 hours, 3 hours, helps. These people are highly constipated and very intense ama um, in their body, accumulation of ama in their body. So influence of the so that's the gut and brain relationship right there. Influence of the intestinal bacteria on brain and behaviors, which is ama, and then that ama manifest in from uh, gut to the mind level, impacts emotional state, so from physical state to mental state, or sometimes it's the opposite, the mental state first and then the physical state, because when you're not in your good state of mind, then you don't feel like eating, or you overeat, and that kills your gut, your digestion. So role of inflammation in the emotional and mood issues is very important, because when people have pain and inflammation, their they have more emotional imbalances and mood issues. So again, it's vice versa, that impacts your digestive system, or digestive system impacts the mood. Digestive health impacts the absorption, and that creates the constipation and increases more or accumulates ama in the body. So that's where panchakarma helps, or any cleansing method, Ayurveda's cleansing methods help. So we know what panchakarma is and how it helps. So if people are not ready to any type of cleansing or panchakarma, they can use some Ayurvedic therapeutic methods to heal. One is massage, abhyanga, from outer body, They can use steam bath techniques and some of the traditional therapies. If they can't do the complete panchakarma, they can still do nasya, use warm oil. They can use shirodhara or different types of external therapies. So especially what the type of addiction, it is very helpful to pacify vata. Then fermentation with pouches. This is also helpful in people with pain. Most of these people have tremendous amount of pain and they can't tolerate the pain, and that is why the addiction part comes in. So food, like I said, food is medicine in most of the times, and you have to be very mindful in treating with with food. So what type of addiction they have, that's a type of element pacifying food you can use. Soothing food, khichdi is very useful. The spices used in it, juices like grape, pomegranate, gooseberries are used. Lemon ginger tea is very helpful due to the cleansing nature of lemon. Whole food recipes, because these people are compromised for nourishment of their body. Tamarind is found to be very effective management of alcohol addiction. These are the simple herbal remedies used. Brahmi, Gurukola, ashwagandha, holy basil, moringa for immunity, to lessen the cravings because of the bitterness of these herbs. Gurmur, neem, and turmeric is used. They're anti-inflammatory as well, and pain relieving. Ayurvedic psychotherapy herbs are used: cardamom, nutmeg, saffron, bacopa. Digestive herbs are used to increase metabolism, especially in pitta type of addiction. Ginger, black pepper, turmeric, trickatu, holy basil. You also have to be careful when you suggest these type of herbs for metabolism, because they also have a lot of psychosomatic disorders. So you have to use it in combination. Constipation and continuous cleansing. Triphala is very, very useful. The oils for the pain or massage, I use ortho oils, so I have that there. Yoga for recovery, it's very helpful for them to create or start creating mind body balance. Pranayama, meditation, all these techniques I have been using. Marma therapy is another one. You just have to find out what type of addiction they have and what type of marma you're using, but definitely they're very helpful in pain and emotional distress, anxiety. Follow up is very, very important and needed. I mentioned it before too, just to increase their confidence level, self efficacy, social interaction, and engagement. Continuous follow up is important. So, thank you very much, because my time is up and there is a lot to talk about, but you can read that. I have book. This is my book, Ayurveda's Wisdom for Management of Pain and Addiction, and there are a lot of details mentioned in this book. Thank you very much. Thank you for attending. Thank you for listening.